Good afternoon. My name is Dr. Mohan Keshavamurthy, Director of Urology, Transplant Surgery and Robotics at Fortis Hospitals, Bangalore. Today, I would want to discuss a very interesting topic, age-appropriate enlargement of prostate along with Parkinsonism. When a patient comes to me in OPD with history of difficulty in passing urine or with frequency or urgency and has history of Parkinsonism, the family is extremely confused on the way forward. The reason being the neurological aspects of Parkinsonism supervening with the elderly person who has difficulty or urgency and frequency of urination. The way forward is a good clinical history. Emphasis should be laid on how many drugs for Parkinsonism has he been using, has the dosage increased, has the number of drugs increased, has the symptoms of Parkinsonism, especially in relation to his locomotor activity. Can he walk with support, without support? Does he have difficulty in speech? Can he eat by himself with a spoon? All these questions form the history of progressive Parkinsonism or stable Parkinsonism. Along with that, we should look at the history of how is his difficulty or problem with passing urine, has it increased or is it stable? Or is he on a diaper of recent origin? Now, once you take a good clinical history, the next important tool, assuming that the patient has come with an ultrasound and a PSA done elsewhere, the PSA being normal, obviously it's the age-appropriate enlarged prostate, there is no question of cancer prostate, most probably, as well as we know in ultrasound the size of the prostate, the amount of urine staying back in the bladder after it passes urine, what we call as post-void residual urine. The important test is to do urodynamics along with ENMG. This will show. The best analogy I can give you is old Maruti car not giving adequate mileage. Is the problem with the road on which the car travels every day? Is the problem with the old engine which is not efficient? Or is the problem, especially in Parkinsonism, with the driver, the mind that controls and coordinates the contraction of the bladder with the opening of the sphincter, the door that controls volitionally our ability to not to leak or not to urinate unless it is socially appropriate. Once we have urodynamics, the next important step I keep telling my younger colleagues is to counsel the family so that the benefit of the procedure, if and when offered, should be appropriate to the expectation of the individual concerned as well as the family. Counseling will basically involve telling them that the stream may improve, but the control of urination or the frequency urgency may not change or may change adequately. The critical element there would be to evaluate the patient appropriate to the needs of Parkinsonism in addition to benign enlarged prostate or age-appropriate prostate enlargement, as well as the neurological impact on the act of voiding urine using urodynamics. If the predominant symptoms are of just obstructive urinary passage, then a simple TURP, that is transurethral resection of prostate, along with appropriate medication to allay the frequency urgency, whether it be oral medication or a simultaneous installation of intravesical Botox, can be done. However, if the neurological symptoms are far too advanced, a diversion in the form of suprapubic cystostomy or advising the family to limit fluids beyond 7 o'clock so that his sleep is not much disturbed, or to ask for frequent voiding every few hours between 7 a.m. and 7 p.m. These specific individual measures appropriate to the patient can be put in place. Overall, in summary, benign prostatic hypertrophy or age-appropriate prostate enlargement along with Parkinsonism is a clinical conundrum. Appropriate treatment needs good clinical history, a urodynamic evaluation, and counseling of both the patient and the family on the way forward. There are a variety of ways where individual solutions can be found to make an elderly gentleman independent of the difficulty of finding an appropriate bathroom or limiting his locomotor activity because he is worried he may leak inappropriately in a social situation, making himself and his family uncomfortable. Thank you.